Hi everybody, my name is Professor Paul Tipton. I'm Clinical Director of T-Clinic in Manchester and also Clinical Director of Tipton Training. I also happen to be the President of the British Academy of Restorative Dentistry, BARD. So I'm here today to talk to you about a brand new online program that we've set up in association with CAPP. As we're all aware, face-to-face training, very difficult at the moment. And so we've been working with CAPP and with BARD to put together a brand new program for you that is totally online. This program is entitled Modern Aesthetic Dentistry Postgraduate Online Mastership. And we're very, very excited about it. And we'd love you to join into this program with us. So what we're going to discuss. We're going to start off with treatment planning. Treatment planning, as you're well aware, most important part of restorative dentistry, aesthetic dentistry. Get the case set up properly. And that involves things like mounted study casts, face bows, diagnostic wax-ups, going through all the different stages of dentistry, but in the right order. We're going to show you how to do that so you can plan a 3-unit bridge all the way up to a full mouth reconstruction. Once we've gone through treatment planning, the next stage is to set up the smile and to be able to do smile design. And we're going to go through smile design from A to Z, looking at center lines, looking at occlusal planes, looking at eye lines, looking at lip lines, trying to make sure that your central incisors look good, and then going outwards into the buccal corridor. All those things we're going to develop with you with smile design. Next stage is to be able to give good restorations. You need to be able to prepare teeth properly. So we're going to look at tooth preparation and some of the brand new variants in tooth preparation. And you need to know some of the basics as well. Some of those basics such as angles, at what angle, convergence angle. We're going to do different preparations. Remember, a different preparation for every convergence angle. Okay, so if you're looking at a 12-degree convergence angle, that's for PFMs. If you're looking at doing a zirconia crown, then you need an 18-degree convergence angle. If you're looking at EMAX, it's 24 degrees. So these things vary dependent on the type of restoration, the material, and also the type of cement that you're going to be using. We'll discuss all of that. We're going to look at margins, margin design, and introduce you to the new VertiPrep, brand new preparation feature. Okay, we're going to talk about vertical finish lines and horizontal finish lines, when to use one, when to use the other. Moving on through tooth preparation, we're going to show you veneer preps and how to get the best out of doing your veneer preparations, doing the veneer prototypes, temporization, impressions, etc., and how to work with your technician. Hugely important factor is occlusion. And we all know if you don't get the occlusion right, then your restorative and aesthetic dentistry will fail. So we have to look at occlusion, and we're going to go through those 5 principles of occlusion with you to make sure you understand every single part of it. Once we've gone through that, then we're into some of the more modern techniques. And we need to introduce you to digital dentistry, and the difference between digital and analog dentistry, and when to do digital and when to do analog, and how much you can do digitally. Moving on from that, it's then into orthodontics, and how can cosmetic orthodontics help your case. A lot of the time nowadays, we're setting up a case by doing orthodontics initially, not long-term orthodontics. We're not talking 12 months, 2 years ortho. We're talking maybe 1 month, 2 months, 3 months of ortho to align the teeth better for us. So when we do our restorative dentistry, we don't have to do as much tooth preparation. And then the final part, which is putting it all together, is not only the teeth, but we need to move on to the face. And during the course, we will talk about how as a dentist you can influence facial aesthetics by changing vertical dimension. And we'll talk about that during treatment planning and occlusion. And then at the end, we're also going to talk about fillers. We're going to talk about Botox so that you can actually improve the patient's facial aesthetics as well as the smile. So we've got an awful lot in there. Be delighted to have you with us. Please sign up or go onto the CAPP website. And I will be with you through all those stages. I'm going to be your online mentor for this program. We've got lots and lots of added benefits, including the mentorship. We've got papers to read. We've got webinars and videos to look at. So please join me. Go to CAPP, go and look at the online mastership, and I hope I'll see you soon. Thank you. Take care.